Welcome to Truth Talk. Take a breath, settle in, and let yourself arrive just as you are. You found your way to a place where the edges soften, where questions become doorways, and where the simple act of listening can open something unexpected inside you. This is a space for exploration, for wonder, for the quiet truths that often whisper beneath the noise of everyday life. Here, we follow threads of body, of mind, of spirit, not to force answers, but to discover what becomes possible when we give ourselves permission to be curious. You might hear something today that feels familiar, like a memory you didn't know you remembered, or something new, something that nudges you gently toward a different way of seeing. Wherever you are, whatever brought you here, consider this your invitation to lean in. Not because you have to, but because some part of you is already listening. I'm Lindsay, your certified clinical hypnotherapist and certified hypnosis instructor. So let's begin slowly, thoughtfully, and with just enough mystery to keep you wondering what might unfold next. Today, we'll try to explore every documented instance where clinical hypnotherapy has intersected with stiff person syndrome, a condition marked by muscle rigidity, painful spasms, and heightened startle responses. A brief, comprehensive literature review by the Stiff Person Syndrome Research Foundation reveals that despite numerous treatment approaches, clinical hypnotherapy remains nearly absent from published protocols. Case 1, Amy, anxiety reduction and graded visualization. Amy, in her early 40s, faced 2 years of worsening stiff person syndrome, SPS, constant stiffness, fear of movement, and frequent falls. However, under Penelope Ling's weekly hypnotherapy sessions, she learned to enter a safe space induction, imagining a vaulted sanctuary where every spasm was honored, not feared. Through graded visualization, Amy pictured her muscles unwinding like threads in gentle fabric and practiced gentle movement within trance. Over 3 months, she regained confidence, reduced fall frequency by 70%, and reported a profound shift in body trust. Case 2, Maines et al. A missing hypnotherapy opportunity. The 2016 report by Maines Aslam, Varghese, and Elliptipikaku, charts a classic clinical pathway: immunotherapy, benzodiazepines, physiotherapy, but omits any psychological or hypnotic intervention. Their detailed account of long term SPS management highlights both the limits of pharmacological control and the untapped potential for mind body therapies. Integrating hypnotherapy into such protocols could address anticipatory anxiety and rewire neuromuscular fear pathways, areas this landmark paper did not explore. Case 3: The Research Gap. The SPS Research Foundation's annotated bibliography confirms only one peer documented hypnotherapy case, Amy's, underscoring a fertile ground for future studies. This scarcity suggests both a lack of awareness among clinicians and a prime opportunity for truth talk clinical hypnosis methods to demonstrate reproducible, ethical, and data driven results in larger cohorts. The synthesis: these narratives reveal that clinical hypnotherapy, though currently underrepresented, can dramatically lower anxiety, rewire motor programs, and rebuild trust in one's body. Amy's success story offers a powerful proof of concept. The absence of hypnosis in mainstream case reports invites further research and integration, positioning Truth Talk hypnosis not merely as an adjunct, but as a transformative pillar in SPS care. References: Clinical Hypnotherapy in Stiff Person Syndrome. Now, to take a look at the published techniques in each case, we'll start with Case 1, Amy's Hypnotherapy Protocol. Penelope Ling's case study details weekly online sessions, combining diaphragmatic breathing to dampen the startle reflex, a safe space induction within a cathedral like sanctuary to honor spasms without fear, and greater visualizations for everyday tasks: walking to the bins, posting a letter, shopping. Each success sealed with an anchor tap to reinforce calm confidence. Case 2, Conventional SPS Management, wherein Maines et al.'s 2016 report describes a multimodal regimen of high-dose intravenous immunoglobulin, IVIG, to modulate the autoimmune response, benzodiazepines, such as diazepam, to enhance the GABAergic inhibition and relieve muscle rigidity, and physiotherapy involving passive stretching and gradual mobilization to maintain functional range of motion. And in case 3, the literature gap, a comprehensive review by the Stiff Person Syndrome Research Foundation confirms that Amy's hypnotherapy case remains the sole published instance of hypnosis applied to SPS, underscoring a fertile opportunity for further clinical investigation into mind-body integration. Which brings us back to today, where we're going to explore the specific hypnotherapy techniques applied in every documented stiff person syndrome case, revealing how each modality was woven into clinical care to calm spasms, reframe fear, and rebuild motor confidence. Case 1, Amy, Penelope Ling's hypnotic protocol. Over 12 weekly sessions, Amy's therapist combines 6 core hypnotic modalities. 1, safe space induction, which is Ericksonian, cathedral imagery with vaulted arches and filtered light, progressive body scan to soften tense muscles from head to toe, language of honor. Each spasm is received, not feared, to build deep rapport. Number 2, diaphragmatic breathing and anchoring, which are guided 4, 7, 8 breath cycles to downregulate her startle reflex. Under his wings, anchor tapped to lock in safety signals at key moments. And number 3, graded visualizations, imaginal desensitization, stepwise imagery. First, picturing relaxed limbs, then walking indoors, then venturing outside. Therapist paced difficulty, so Amy experienced small wins in trance before moving on. Number 4, transformative metaphors. Golden ember metaphor, mining embers of past survival from silver ash. The mosaic of strength, each ember placed in an inner cathedral to reframe her body's story. Number 5, Quay-styled autosuggestions. With every pulse, my strength awakens. Rehearsed 5 to 10 times per session, then embedded into self-hypnosis audio Amy used daily. Number 6, homework and self-hypnosis training. Daily perseverance tap, clean heart, bright soul, each morning and night. Recorded induction to replay before medication or physiotherapy, reinforcing new motor patterns. The outcome? Over 3 months, Amy's fall frequency dropped by 70%. Baseline anxiety halved, and she regained trust in walking unassisted. Case 2, Maines et al., 2016, a hypnosis gap. In this detailed clinical report covering IVIG, benzodiazepines, and physiotherapy, no hypnotic modalities were employed. While muscle tone improved by GABA enhancement, the absence of anxiety-focused trance work left fear avoidance unaddressed. This omission highlights a missed opportunity to use safe space induction to contain spasm-related trauma. the potential of ideomotor feedback to recalibrate muscle tension unconsciously, how embedded commands could have broken the cycle of startle triggered rigidity. Case 3, Research Foundation Review, the untapped field. A comprehensive SPS literature review found only Amy's case featuring hypnosis. No other peer-reviewed trials exist, yet the Foundation's summary suggests Ericksonian confusional techniques to interrupt spasm loops, future pacing to guide the body into new fluid movement scenarios, somatic anchoring, light touch or posture cues to lock in relaxed motor programs. So, what would the call to action be? Well, the singular success with Amy urges larger controlled studies, integrating Truth Talk's triune approach, sincerity, enthusiasm, perseverance, to harness hypnosis systematically for SPS relief. So, in summary, Amy's journey demonstrates how a blend of safe space induction, breath anchoring, graded imagery, transformative metaphor, and autosuggestion can rewire neuromuscular patterns and restore body trust. The absence of hypnotherapy in other reports underscores both a research gap and a golden opportunity that Truth Talk Hypnosis stands ready to fulfill. Now, for further review and study and research on your own, you can check every known published or publicly documented case in which clinical hypnotherapy has been applied to stiff person syndrome, SPS. Ling P. ND, stiff person syndrome, Penelope Ling hypnotherapy. Case study Amy, 40s with 2 years of progressive SPS, who regained confidence in walking, reduced falls, managed fear of movement through weekly hypnotherapy sessions focusing on anxiety reduction and graded visualization exercises. And then there's Maines, PK, Aslam, SM, Varghese, M, and Elipakukati, L, 2016, Stiff Person Syndrome, a case report, Journal of Medicine cases 7, 10, 426 to 428, DOI 10.14740 / JMC 2619W. Now, although this report does not include hypnotherapy, it means that it remains one of the few detailed case accounts of long standing proof that progressive management could help. For more information on stiff person syndrome, you can find the Stiff Person Syndrome Research Foundation at https www.stiffperson.org / SPS literature review. You can also find information at https www.oxford hypnotherapy.co.uk /problems /stiff person syndrome /. And there you can find information on Penelope Ling hypnotherapy, the stiff person syndrome case study of Amy. Please tune in to the next episode where we go a little bit deeper into the stiff person syndrome and protocols that can be used I personally have written some myself on behalf of a friend who is a huge fan of a singer that you may have heard of from Canada named Céline Dion, who publicly broadcasted or let it be known that she was diagnosed with stiff person syndrome. I'll see you in the next episode.